Welcome back to the Migrant Health Series of the Reimagining Global Health podcast. My name is Emily and I'll be your host today. If you have not yet heard the other 2 episodes in the series, I really encourage you to go listen to the great interviews with Amar, a medical student and refugee who speaks about his personal experience, as well as Daria and Kenzie, the co-presidents of MedCom, who discussed linguistic barriers in healthcare. In this episode, I had the chance to interview Pénélope Boudreault, a nurse and director of operations of the Montreal branch of Doctors of the World. Doctors of the World is an independent international group who fight for universal access to healthcare. In Montreal, the organization has opened a medical clinic for migrants with precarious status who are not covered by public insurance and do not have the financial means to access healthcare. Please enjoy this interview and I'll see you on the other side. Hi everyone. Today we have the chance to speak to Pénélope Boudreault, who is a nurse and director of operations in Montreal at Doctors of the World. So hi Pénélope, we're so glad to have you today.
Hi Emily, thank you so much for the invitation.
So first of all, can you tell us a bit more about Doctors of the World and its mission and the services that you offer?
Doctors of the World is a humanitarian organization. It's all around the world. We have I think it's 17 delegation. It's mostly known in Europe. It's bigger in France. The difference between people know a lot more about Doctors Without Borders. So it's different. At the beginning, it was the same organization. And then with the story, we all have our own way of telling about the story. But there was a scission between doctors that wanted to plead, to advocacy for the thing that they were seeing all around the world, and other doctors that didn't want to, because they were saying that if they did that, they were not going to have access to people in need in all the countries, war countries, and places like that. So Doctors of the World is born with the doctors that wanted to do advocacy. So we still do that here for all the delegation of Doctors of the World. And the main difference right now is that all Doctors of the World have local project and abroad project. So we want to give healthcare services to people that are in the rich country, like Canada or all countries in Europe, as well as giving opportunity to have healthcare services to people in other countries. Here in Montreal, we are present. We're gonna have the 25th anniversary of Doctors of the World in Montreal. So we've been here nearly 25 years. Dr. Jean Thomas was the founder here in Montreal. The beginning of the project was to go and see people in the street, people that are doing sex work, using drugs, living in the streets, and giving access to sexually transmissible infection, to treatment and blood testing. And we are right now working with the same population through a mobile clinic. And we also have a clinic since 2011 that give access to healthcare services to undocumented migrants.
That sounds like really great services that Doctors of the World offers. Can you tell us a bit more about the migrant clinic and the kind of services or the population that you see there?
Around 2009, we start to have person coming to us when we were working in the street. There were undocumented migrant or migrant waiting to have their document, but they didn't have access to healthcare services. So it was really different for us, because Doctors of the World is really giving access to health services, but bringing people to have the services through the system, because we know that the services are better in the system than what we can give in the street. But those people didn't have access to healthcare services. They were workers that got injured while working, pregnant women, mental health issues, and all the issues with chronic diseases, diabetes and high blood pressure and stuff like that. So we went to see what Doctors of the World were doing in Europe. We went to see the Dr. Paul Cofford, which is working the first clinic for undocumented migrants in Toronto. And we went to see all the group here in Montreal that were working with migrants. And they all told us the same thing. If Doctors of the World, you are nurses and you are doctors, so please just see the people, because when they come to see us and they need medical assistance, we don't know what to do. So it's a walk-in clinic. We start really small. We were a bit worried about immigration, because we were going to have all those people that sometimes don't have status in Montreal, in Quebec, and have them at the clinic. So we were kind of worried that we would have trouble with immigration, which never happened. But it's been like 5 years that we have the walk-in clinic at near the Metro Crémazie, so people can come and walk in. We have social worker, nurses, and volunteer doctors here to address all kinds of health problems that people can have.
So, if I understand correctly, the clinic is really geared towards undocumented migrants who find themselves in Montreal and unable to seek any services. So, can you explain a bit more about what is considered an undocumented migrant and how do people get to that status?
We use undocumented, but in French, we use migrants à statut précaire, so precarious status, because many of the people that we see have a status. They are visitors, but visitor, not tourists. Like they get here, and while they are waiting for their status, they have the visitor status. We have student, women, or sometimes men, but mostly women waiting for the sponsorship. So while people are waiting to get a status, humanitarian status, other kind of status, they have no rights to healthcare services. So that's the people that we see at the clinic. So yes, we have undocumented migrant people that are not waiting to have a status. They tried to have one and they were refused, so they cannot have one, or sometimes just didn't never apply for. But it's all kind of people that are in this situation when they don't have access to healthcare services. So we are not working with refugee seekers because they have access to a special healthcare services.
On that note, could you talk a bit more about what the healthcare services that are available to refugees, asylum seekers, and kind of the gaps that the people that you see at the clinic find themselves in the system?
Yeah, the federal program for refugee claimer is kind of the RAMQ, so the system that we have, like when you have access to the RAMQ, but it's really specialized for refugee claimer, give access to medical services, to medication, and to other kind of services. The problem is that caregiver that are giving care through that program needs to be to register to the Blue Cross, because the Canadian government do the partnership with the Blue Cross. And so lots of places, the problem is that lots of places or clinic don't know, lots of doctors don't know, or don't want to register because it's complicated. You need to fill up papers and stuff like that. So even if we say that refugee claimer does have access, they have difficulty to have access because it's not all the clinic that do give access. Lots of people come to Doctors of the World and they have access. So it's another problem. They don't understand. So when you get here, it's all different. you're going through immigration, it's pretty complicated. Then you get this brown paper that give you access when you are a refugee claimer. But sometimes people just don't even understand. And with the language barrier, and so there's still work to be done to make sure that refugee claimer, even with that program, which is kind of good, have a better access to services because they are entitled to do. The people that we see here, like pregnant women, people with mental health issues, chronic diseases, they don't have access. And even the one that are studying, sometimes, and even people that got here pay to have private insurance, but the private insurance are really expensive, and then they don't cover for anything that was free. When you had a sickness before you travel, it won't cover. So all the chronic disease are not covered. Majority of the private insurance won't cover for pregnancy because it's something that you can decide. So it's not like an emergency. So you should, as they say, decide that you won't get pregnant. And there's lots of times people that have private insurance need to pay upfront, or they have a care or they have a need and they don't know if it's going to be reimbursed by the private insurance. So it's kind of really complicated. And anyway, the majority of the people that we see at Doctors of the World don't have the money to pay for that. It's too expensive. At Doctors of the World, we do advocacy to make sure that, well, we want that everybody has access to healthcare services. So that's what we think. We think that having access to healthcare services is a right for everybody. So everybody should, and it would be a lot less complicated to just give access to everybody that are here in Canada.
And you did talk about the advocacy work that Doctors of the World do, which I think is really important to promote universal access to healthcare for all. I know that there was a campaign to increase access for children who are born of migrant parents. Can you talk a bit about that project and what kind of results came of it?
It's been, I think I can say 10 years that Doctors of the World is working on that. So lots of people don't know, but if you're born in Quebec, you have the citizenship of Canada. So lots of people here think, oh, people are coming to give birth here because it give the rights to have citizenship and everything that comes with it, which is not true. One of the parents needs to have access to RAMQ, so healthcare services here in Quebec. If it's not the case, if your two parents are undocumented, let's say, or they don't have access to healthcare, to the RAMQ, the baby won't have access. So he's going to be Canadian, he's going to have the Canadian citizenship, but won't have access to healthcare services. So it means that we see at the clinic like newborns that don't have access to healthcare services, even if they are Canadian. So we fight for that. We fight for the right to people that are born here, Canadian citizen with the Canadian citizenship, to have right to healthcare services. But we as well we are fighting to give access to all children. So to make sure that in a family you don't have one children that have access and the other one won't have access. The government right now, just with the COVID, so it's been huge and really complicated since a year for people that don't have access to healthcare services and have precarious immigration status. So everything is just worse. So lots of groups, not only Doctors of the World, have been fighting and saying to the government, you just need to give access to people to healthcare services. But as we were talking about the kids that are born here since a long time. The government said, like it's been maybe a few months, okay, we're gonna give access. It was from a previous government, it was said, nothing was done, and this one just said, okay, we are going to do it. So all the groups, we kept fighting, and now we're passing, it's the projet de loi 83, the bill 83, a projet de loi anyway. They're all looking at this, and it's gonna give access. That's what we're looking. We're giving a presentation this Wednesday in front of the commission, lots of group, to say that this project is really nice. It's going to give access to children born here, but as well it's opening to other kids as well. We're just like trying to make sure like you need to be living with your parents since you're born, and so to make sure that really kids will have access. So that's a big advocacy that Doctors of the World has been doing for a few years. And we hope that like in a few weeks, months, kids will have access.
That's really great to hear that the advocacy project actually led to something really concrete. And hopefully, as you said, it will give a lot more access to kids to healthcare services that they need. Speaking about COVID, and I'm sure it has had a huge impact on the migrant population. Is your clinic still open? Are you still offering services? And what are some challenges that you found during this pandemic with the population?
The clinic is still open. I think we closed 1 week in last March to try to think what we were going to do. We had the walk-in clinic. Now everything's went back to the phone. So we can't have like 40 people walking in the clinic. It's not possible anymore. So we went back to the first way that people could reach out to us. So they need to call a line, and then we have volunteers that answer the phone, make sure like, are you a refugee claimer? Are you a tourist? Because we don't see people that are just passing in Quebec. So to make sure that we see the population that we can see. And then they give appointment to a social worker, which is specialized in trying to help people to regularize their situation, their immigration situation, give them access to healthcare services, public healthcare services, if it's possible. And then the people can see a nurse and then a volunteer doctor here at the clinic. So it's been a year that we work that way. We still see kids and pregnant women and all other adults. To be able to work, we did this was before COVID, but we did all kind of partnership with hospital, with labs. So like, it's okay to see somebody here with volunteer doctor, but if we have no access to blood test, to x-ray, to any other specialized exam that we need to. So we did lots of partnership with lots of places to make sure that we can go just a little bit further with the healthcare services that we can provide. But at the end, like when we face people with cancer or like other kind of sickness, we can't do surgery, so we get to an end like pretty fast with some people.
Mm-hmm. And when you get to that end, are you able to refer them to, let's say, a hospital that you're affiliated with?
Not always. Like cancer, like we say that people can have access to healthcare services through the system when it's an emergency. But an emergency, it's you have a car accident, you're not able to walk, the ambulance will bring you to the hospital. That's an emergency. You're bleeding to death, that's an emergency. But otherwise, like you need a cancer, that's not an emergency. So majority of people won't have access to healthcare services. So even to us, even if we have volunteers and we have like many doctors that raise their hand to say like, I won't charge, I will do it pro bono. But the hospital won't do that. So if we need any surgery or like chemotherapy or things like that, it won't be a possibility. Sometimes we have to sit down with people and see if it's an option to go back to their country. But like I was saying before, we see people in really precarious situations. So we don't see the one that sometimes we heard on television or the touristic medical thing, like people with lots of money. No, that's not the situation here. We see people that are leaving their countries because of war, because they lose everything, because they just want a better situation for their kids. And they get here and they have no money and they want to stay here, they will stay here. So they are the future population of Quebec, and they don't have access to care. So sometimes it's a reality. We just face a wall.
So it sounds like not having access to an insurance or to healthcare definitely has consequences on the health outcomes of these patients. Can you talk a bit more about that and what kind of consequences you've seen while you've been working at Doctors of the World?
It's sure that we're not talking about prevention. So here, like, it's a big thing. Prevention is good. It's a great thing. We need to do that. With migrant with precarious status, we're not talking about prevention. So when we see them, it's because there's something going wrong. So as long as we can do something here, that's fine. But if you wait and wait and wait, the health problem will get worse. And if they get to go to the hospital, it's just because it's got so bad that it's, and if we're talking about money, it's just going to be more expensive. And another thing that we see lots of pregnant women that won't have any follow-up. No, I'm not talking about echo to see the baby. I'm talking about no follow-up. So having the baby, not knowing if he's growing well, not knowing if the health of the mother is fine. So this has an impact of the baby to born. The other big thing about that is the mental health issues. So if you know that your kid is sick, but you can't go to the hospital because you don't have the $400 that you need upfront to see a doctor, or that you're scared, even if it's not true, but that you're scared that it's going to affect your immigration status or your possibility to stay in Quebec. If you're not able to pay for the bill in the hospital, you won't go. Or lots of people coming to Doctors of the World saying that they have a heart problem or stomach problem, burning problem, and at the end it's anxiety, stress, because they came here for a better situation and everything is complicated. The immigration is just hard and long. They don't have the money, they can't work, so everything is so complicated that it does have impact on their health.
You said that you've been working at Doctors of the World for the past 15 years. What kind of changes in the system have you seen in these years, and are things getting a little bit better for migrants with precarious status?
I have to say that at least we're talking about about them. So we're in constant discussion with the public health in Montreal, which recognize their presence, their needs, their special needs. Same things with Montreal City. That at least we are talking about them. We don't know how many there are in Montreal. we heard, well, like we're talking about like 10,000, 50,000. There's just no way to know how many people are in this situation. And as we were talking before, their status is just changing. Sometimes they are waiting for a status, so they can be without status, going to a status, losing that status. So it's really complicated to know. Since COVID, like COVID for the last year, we were talking about it was bad in some populations and some part of Montreal which were sometimes poorer, where the information didn't go through, where the information was not in the right language, in the not explained the right way. So I think people want to recognize that it's a population, they have needs, they have rights, but it's not moving fast enough. That's what I want to say.
Yeah, definitely. It sounds like it's very slow to change. And although there is maybe more recognition that this is a population that exists, those changes are not really reflected in the actual services that they get. I'm sure working with this population poses a lot of different challenges in terms of systemic barriers and even linguistic barriers or cultural barriers. But what is a very rewarding part of working with migrants with precarious status?
I think I would say that they always, even if sometimes we are not able to do that much, they always so grateful. Just sometimes we see people that haven't seen a doctor for years, and having people taking the time to listen to them and give the right cares, not just like brush them off. We are giving our services to people that have really precarious situations. So sometimes we have really hard story that people are telling us, but having access to this resilience, or people that have been through so much and they still see the bright side, and they are happy to be here in Quebec, and they so this is nice. This is really rewarding, really, to see them and um, make just a little difference in their life, even if sometimes it's not that big. And having access to those rich people with that story and this amazing capacity of sometimes letting behind all the trouble and just looking in front of them. So this is rich.
That's really inspiring to hear. Would you have like an example of a story that you heard while working at Doctors of the World that really stuck with you?
I have so many, so many. I guess like being a parent myself, seeing all those parents with the small kids and like pressing. I haven't had one woman that came all the way from America, from I think it was Brazil or Colombia or something like that, with her like 4 kids crossing all the borders from there to the U.S. and to Canada, and with those small kids, no immigration, nothing here, no money, and just doing that to make sure that her kids will have a better life that she had. So this make all the small problems that we have every day like really so tiny. But yeah, we have here amazing person that make us believe that we need to still do that, even if sometimes it's not always easy.
Have you heard of other initiatives outside of Doctors of the World that are trying to help this population? And has that been more increasing in the past years with the recognition that this is a population that needs help?
It's sure that all the groups, like community groups that are working with people, so helping them out with work, with rights. So there's many groups that are doing their best. There's the head in hands clinic, which help the 14 to 25 years old, which is doing kind of the same work that we do for 14 to 25. So things are moving, but in the way of giving access to healthcare, because that's what we see here, and every day we are facing what we are going to do, who are we going to ask to. The new generation of doctors, but nurses, social worker, we see really they want to know and they want to give access. So and still we have doctors here that have been working for years and years. So even the other generation, but we see now that with all the opening, all the movement that there's that's present all around the world, but here in Montreal as well. So yeah, the future is bright. So we have to continue the fight, but the future is bright.
Thank you so much for sharing that story, Pénélope. And that concludes all of my questions. I again want to thank you for joining us today and discussing about the services that Doctors of the World offers, as well as the barriers that migrants with precarious status face in the healthcare system. It was a very insightful conversation. Thank you.
Thank you so much, Emily, and thank you to everybody that take the time to listen to it.
Thank you again so much to Pénélope for this amazing interview, and thank you to everyone out there who took this time to learn about the health inequities faced by migrants, as well as the services offered by Doctors of the World to help this population. This episode concludes our series on migrant health, so please listen to the other 2 episodes if you have not done so already. Don't forget to subscribe and leave us a review if you enjoy this podcast to help other people find it too. And we will be back very soon with more episodes on different topics in global health. Follow Reimagining Global Health on all social media platforms. They're linked in the show notes. And we also want to take this time to thank our collaborators in the series, Collaboration Interprofessionnelle Montréalaise Étudiante, and the International Federation of Medical Students Associations Standing Committee on Human Rights and Peace. Check out their amazing work by following them on social media. They're also linked in the show notes. And have a great day, and we will see you very soon.